Hello, everyone. This video. We're really glad that you're joining us here again on Friday afternoon so that we can give you an update on coronavirus and what's going on in Berrien County and some of the things that are happening with response, trends in the data, and other things you need to know to continue to keep yourself safe. So I know one thing that people really like to hear at the top of our program here are the numbers. So these will be posted on our social media, and our dashboard will be updated this afternoon. But we're looking at, we have 571 confirmed cases now, 194 probable. And again, those probable or presumed cases, those are individuals that maybe didn't have that confirmatory test, but they did have COVID-like symptoms. We are reporting 42 deaths, which is an additional 2 deaths since yesterday. And there's 368 people of those confirmed cases that have recovered. So that's really good news. We'd like to see that recovered number continue to increase each week. I know what we've talked about a lot around here, around the county, and at this Facebook Live is some of the things that we're watching for in the data, and this is becoming really important as we're thinking about reopening. Reopening's on everybody's mind, isn't it, Undersheriff?
Yes, it is.
So some of the things we're watching for are trends in the number of confirmed cases, and if those are going up or down or maintaining, the percent of our tests that are positive, what's going on with deaths and hospital admissions. And I'm sure those of you who've been following along for a while, we've all been noticing that we're seeing increases in the number of our confirmed cases and in the deaths and hospital admissions. And to give you all a little bit of an understanding of why that's happening. So first of all, we're expecting to see more confirmed cases, and that I believe is going to continue to happen over the next several weeks. Part of the reason for that is we're doing more testing. We're doing more testing of the general public, but we're also doing some more testing in congregate facilities, even like the jail. Do you want to tell us a little bit about what's going on with the jail?
Sure. So as last week talked about, our strategy in testing was systematic approach. And then we were approached in our region with the Michigan National Guard. To our staff, so the Michigan National Guard working with the emergency management with the Michigan State Police. They brought down 2 teams to, go through the jail and do that. It is voluntary. The inmates can refuse, and same thing for staff. But we're looking for, that's a snapshot. It doesn't tell us, for the next couple of days. We will continue the strategy of systematic testing in the jail, but it does give us an indication, and we're thankful for the help. I know there's several counties, jails in our district that are doing that today. So we're just appreciative of that offer.
Yeah, absolutely. But the impact that then has on the numbers, we know that if we test a few hundred people in a day, we're likely to find some asymptomatic carriers. And that's good. That helps us identify the asymptomatic carriers. We can do some quarantine and isolation, regardless of the facility that they're in, to help stop spread. But then what that does is it continues to add to that confirmed case count. So I know some of you are wondering, oh my gosh, what's going on? It feels like once we hit 300 cases, we're now at 571 pretty quickly. And this is what you would expect as we continue to increase the amount of tests that are happening, not only in these sorts of institutional facilities, but also to the general public. So that's definitely why we're starting to see these increases. What the good news is that our percent positive rate is decreasing. And this is another really important marker, and we believe it's what the governor is using to help make some of her decisions about how different regions are reopening. So that's the total number of cases done in a community with the percent of those tests that come back positive, and we want to see those trends go down. We are seeing a downward trend over the last 11 or 12 days. We've seen a pretty significant decrease in that percent positive. We're continuing to hope to see that go down, and that's really good, because as our capacity to detect COVID goes down, we want to see the number of cases go down. We do also know that a big contributing factor to some of the increases we're continuing to see in inpatient admissions and deaths is due to transmission that's happening in our long-term care facilities, like nursing homes and assisted living facilities. And this is a really tragic thing when it happens and it gets into these facilities, and it can be really challenging. When you have people who are very vulnerable to serious illness and even death from a COVID infection that are living in relatively close quarters, it's easier for transmission to occur and to have some pretty devastating results. So this is something we're continuing to work with. We have really fantastic skilled nursing facilities here in Berrien County that are dealing with some of the transmission that's happening there appropriately. But we know that as there is transmission out in the community, that does impact our congregate living in our institutional settings like nursing homes, potentially in jails or homeless shelters or some of these other settings as well. We have not been seeing clusters. We haven't seen that in jails or homeless shelters or anything like that. We're monitoring for it and we're doing the testing. But in our nursing homes, has been transmission. There have been deaths of nursing home residents, and that is contributing significantly to the increases we're seeing in hospitalization and deaths. So that matters a lot. We're very concerned about all the people that are impacted in that way. It is an important piece of context in interpreting the data. And we've talked a lot about how chronic conditions are really important risk factors to understand in vulnerability. Some of these chronic conditions that we're seeing are hypertension, it is diabetes, it's cardiovascular disease. Those are things that are relatively prevalent in our community as well. For anybody who's been following Berrien County Health Department for the last few years, those are things that we've consistently shared that we're working towards. So a lot of these things are playing off of each other. And that's why it's really important for everybody to understand risk reduction, because lots of people do have very well-controlled hypertension or well-controlled diabetes, or there are some of these things. Risk reduction is going to become really, really important. So we can't get ourselves to a no-risk situation, and no one can eliminate the risk of COVID-19, but you can reduce your risk of infection and make some informed choices as to how you're going to move about in your life, especially as more and more things reopen. We did hear from the governor yesterday. That was yesterday, right?
Yes.
Yeah. Yesterday.
Goes together.
The time is blurry. We did hear yesterday we're allowed to have gatherings of less than 10 people. Certain retail is going to be opening. Do you want to give us some of the highlights from that, Undersheriff?
Yeah, so some of the retail auto showrooms and some others are going to be open by appointment only, still by appointment. The main thing that people have on their mind right now is going into the Memorial Day weekend. Yeah. You can have a gathering of up to 10, but it's still important, as you mentioned, with the risk reduction, who that is, and social distancing still needs to be adhered to. So people hear gatherings, and even within that gathering, social distancing is still vital to the defense, of the virus. And as like you mentioned before, if you have several different gatherings at different times of 10 people, that just widens that, the access or increases the risk for that. So just to, again, as we've said many times, social distancing is really our only defense right now, with not having a vaccine or any antidote for that. So.
Yeah, and just to give an example to that, so if I want to have a barbecue at my house with less than 10 people, I can do that on Saturday. But then if I invite 9 different people over on Sunday for another barbecue, that's perfectly legal. But now I had those exposures to 9 people. Anybody else I come in contact with on Sunday, say, now sort of has exposure to some of those other people. So yes, you can have those gatherings. That's why maintaining the 6-foot distance, the social distancing, even when you're having these small gatherings, remains really important, as do face coverings, because just the number of contacts and those connections can dramatically increase, and then that can really drive our curve up. We do expect our curve is going to drive up. You've all seen this visual before. We're in a little bit of flattening right now. We expect to have a bit of an increase as there are just more connections between people, but then to flatten off again. Maintaining those social distancing, doing things to reduce risk are really what are going to help us have that plateau still below the surge capacity of the hospital. So some things to be thinking about with risk reduction, and maybe some ways to think about this. So consider, are you partaking in activities that are either outdoors or indoors? Fortunately, we've got some good weather coming, which makes it even easier to be outdoors, but outdoors is less risky than being indoors. The size of the group. It might be legal to have a gathering of up to 10, but 5 is safer than 10 just because of all the connections. And it's just easier to maintain social distancing with fewer people. The length of time matters a lot too. This is spread by person-to-person droplets. So it takes 10 minutes of close contact to be considered a risk. So if it's just a quick 1-minute exchange, that's a lot different than, an hour-long face-to-face conversation. So keep some of those time frames in mind, as well as face coverings. If everybody is wearing face coverings, everybody's droplets are going to be better contained, not fully contained, but better contained. There will be few of them out in the environment. That is reduced risk compared to no face coverings on anybody everywhere. And of course, hand hygiene, that matters a lot. And again, thinking about this is person-to-person spread. The role of surfaces in transmission is not nearly as significant as person-to-person spread of transmission. So disinfecting high-touch surfaces is not a bad idea, but that can't be your sole strategy. You have to really pay attention to this person-to-person spread. And we've talked about this before. We had the executive orders that came out, but to be honest, we really don't know what's going to happen on May 29th, do we? We don't. So, we're hoping. We've seen some other regions of the state maybe be opened up more than ours, so we're waiting to see. Kind of as you mentioned, though, with the nice weather coming, Memorial Day weekend, one of the questions we're getting a lot at the county is county parks. So, part of the order is for people to get out and have recreation activity. As you mentioned, outdoor activity is a good way to do that. But, particularly Silver Beach, it is open. But we need people to understand it's not the Silver Beach that you're used to. One, with the water levels the way they are, there's just not as much beach as there was. So that's going to make social distancing and keeping that apart. We will have a deputy working with the Parks Department down there to monitor, the beach. And if it gets to be too crowded, we'll be closing. I know they're already looking at capacity of vehicles probably at 50%, and that'll be closed like it would have been if it was, at the floor. The other thing to remember is the public restrooms are not open, so there's very limited porta potty facilities there. The volleyball courts, the playgrounds, and those type of activities are not allowed right now. The concession stand will be open, but it's going to be limited, and they're going to work on how they can do that social distancing. So it's great to get out and get exercise, but it is going to be a different experience. We want people to get out. It looks like it's going to be great weather. Rocky Gap County Park is also opening, but again, we just really need people to adhere to the social distancing just for the safety of everybody. Yeah, absolutely. It's not going to be our typical go spend the entire day at the beach that we may have been accustomed to. Especially for family with kids, and knowing that the restrooms are not open and planning for that ahead of time, it's going to be a different experience, but we do want people to be able to enjoy, the great weather, and we're hoping it is, great weather. Yeah, absolutely. That's really important. So, thinking about Memorial Day weekend as the kickoff to some of these summer activities, I think we don't have a crystal ball. I wish we did to predict how the rest of the summer or the fall might go. And I know a lot of people in these really uncertain times really want some certain answers, and I want to be able to provide them for you. We just don't know what's going to come. But some predictions and projections that we're making about what this might look like, as I said earlier, we do expect spread to continue. We do expect all of these risk reduction measures that we've been talking about to be part of our daily lives for probably several months, probably until we have a vaccine. So thinking about what your social life looks like, where it unfolds, how it unfolds, is something that's definitely going to be part of our life. And not just our social life, our workplaces as well, because businesses are starting to prepare and gear for reopening, those that have not been able to yet. But we do expect transmission to continue increasing. It's a matter of how do we make sure that we keep transmission at a level that's low enough that the hospital still has room to provide care to anyone who may need care. So that's really important. Here at the health department, we have been working in throughout the county. I know all the county departments have been doing this. We have a safety plan. All workplaces are required to have a COVID-19 health and safety plan. So at the health department here, we've enacted our plan. We have certain places that are designated where employees and visitors must be wearing masks, and this is in alignment with the executive order to wear masks in enclosed public spaces. But we're also moving towards reopening some of the services that we had to put on pause during the initial phase of response. So stay tuned, but starting June 1, we will have, as the health department, we have more of our clinical services are opening back up, some vaccinations. We know that we're concerned about children that may not have been receiving vaccines on time throughout this time period. That presents a risk, and we don't want that to continue. Our sexual health services are growing. We had reduced them down to very minimal essential services, but we're working to boost that because we know that continues to be important. So if you have questions about health department services or what is open, our website is a really good place to look. You can also call the health department. If it's a program that you've been part of, you can call your contact in that program, but we're doing a lot more at looking towards that as we move into June, definitely doing it in a way that minimizes that risk. So that we can do it safely and healthily, but there's always that balance of doing everything to prevent disease transmission. There is a cost to some of those measures, and we have to really weigh the costs and benefits of all of these. One last thing I want to say before I think we get into some questions. We do have 4 locations in Berrien County that are available for testing, and I know we've talked before about how the Lakeland Outpatient Center it does drive-through testing. You do need a doctor's orders to be able to access that, but you can talk to your primary care provider if you feel you need a COVID-19, and your primary care provider can work with you to determine if that's best, and then put those orders through. Intercare in Benton Harbor also has drive-through testing. If you don't have doctor's orders for Intercare, they will walk you through a screening process to determine your eligibility for testing. Rite Aid in Bridgman and the Walmart in Benton Harbor are also offering testing for the general public. You do not need a doctor's orders to access the tests at Rite Aid in Bridgman or Walmart Benton Harbor, but you do need to call ahead or go online to schedule an appointment, and they'll walk you through a screening process. At those 2 pharmacy locations, Rite Aid and Walmart, it is for those 18 and older, not for those under 18. So with that, I think, what questions are we getting?
One other thing, just,
yes,
you talked about county facilities, and one that I know we mentioned last week is the courthouse. So I know the health department is very, very integral in working with the court administration. So the court is under a little different guidelines. They've got a 4-phase approach for how they operate, and there's some guidelines. So I know they're working with the health department to make sure as they meet those. Phase 1 really is not much different than what the courthouse is doing right now. So I would just say, stay tuned. As you mentioned, county website is a great place to get that. As we talked about Silver Beach before, Silver Beach has its own Facebook page where updates will be given. So, we are looking at how that reopening takes place, but it's got to be done safely. And just one more, thing for the health department. We've worked very close with the health department with the testing we talked about in the jail, with your staff, and we'll continue to do that. If as results come back, they come to the health department, and we'll continue to work on, how we deal with that going forward. So
yeah, absolutely. Did you have some updates from our nonprofits?
Yeah, so a couple of nonprofits. We work. United Way is a big portion. Other nonprofits of the Emergency Operations Center. So just a couple things. The Salvation Army in Niles partnered with Southwest Michigan Community Action Group and delivered 50 dairy boxes to low-income housing units. And then an interesting part is the senior nutrition. The Meals on Wheels for the month of April did 19,000 meals, and their normal month would be 10,000. So it was a 9,000 meal increase for them. So we're appreciative of the nonprofits and how they're stepping up, to help in this difficult time.
A lot of needs have come up, and our community has really risen to the challenge.
Okay.
Yeah. Great. Do we have some questions from?
Yeah, so speaking of needs in the community, if people still would like to donate, specifically donating masks or face covers, how can they do that?
So the United Way is the agency. It's kind of the point for that. They'll get it distributed, through the EOC and the health department. So the United Way is a great opportunity. If you go to their website, there's some times that can be dropped off, but the United Way is our partner in kind of accepting those donations and getting them to the right places.
Yeah.
If I test positive for COVID-19 and repeat my test again to show a negative result before I can go back to work?
Yeah, this is a question we've been hearing about a lot. So CDC guidance has 2 different ways to be able to clear a person to go back to work. So there's a test-based strategy that says if you have 2 consecutive negative tests that are so many days apart, you're considered to not have the virus anymore and would not be infectious. However, that test-based strategy only applies when you have an unlimited supply of tests, and we still don't have that here in Berrien County. We're using what's called the time-based strategy, and so that means that you need at least 72 hours to have passed after symptoms have subsided, and it must be at least 10 days since your symptom onset. So you have to be at least 10 days beyond the beginning of your illness and 72 hours since your symptoms have resolved. So that's what we're working for. We're really working with, trying to work with employers to make sure they understand that. Businesses or employees can contact the health department if they need more information about that.
I was really sick in January and had a bad cough. I think I had COVID. I want to be tested for antibodies. Tell me more about how reliable those test results are.
Yeah, so antibody testing is not something that is widely available in the community. Quite frankly, the scientific and public health community, the jury is a little bit out as to how we can use and interpret a lot of those results. So there are some antibody tests that are not specific enough to this type of coronavirus. There are many types of coronavirus. This is a new strain. It's a novel coronavirus, hence why none of us have any immunity to it. But some of these antibody tests pick up on antibodies to coronaviruses, but maybe not specifically to COVID-19. And then there are others where we might be able to detect antibodies, but we don't know what level of antibodies actually confer immunity. So even if we might know that you had this, we're not 100% sure how well that protects you. So antibody testing is not available in our community. There just isn't a place for the general public to get that. Antibody testing is being used for those who wish to donate convalescent plasma. So it's being used in that setting. We're still watching the scientific literature and seeing how antibody testing is unfolding in other communities. There are some really hard-hit areas like New York City and Detroit that are doing some research tests of the general public of antibody tests to just see how much transmission may have happened that we didn't capture through viral confirmatory testing. So that's how that's being used. There's a lot of that in the media. The expectation of just knowing, hey, I had it and now I'm good to go, that's just not where the science is right now. And I would say for people that were sick in December or January, the chances are incredibly slim that what you were sick with was COVID-19. There are hundreds of viruses that cause respiratory illness, and some of them can feel very, very debilitating.
I've been really concerned shopping out at a few stores or picking up food at a restaurant that the workers aren't wearing masks or gloves. Who do I complain to about this?
So the tip line is still available. The only thing for us is obviously executive order requires in certain places like food establishments and that to wear it. The other part of the executive order is it does say if you cannot medically tolerate it, you don't have to wear the mask. So the order also did not say that you have to have a doctor's note for that. And right now we know, even though some things are being opened up a little bit, we don't want people going to the doctor to try and get that note. So, it is difficult. A lot of stores are adhering to it, and we're trying to educate and kind of warn of that. I mean, the order is in place, but with a medical tolerating piece of it and not requiring a doctor's note, that does make it difficult.
Right, and if we go back to thinking about where's our highest risk and where's our lowest risk, I would count the typical grocery store interaction with a worker or even other customers to be pretty low risk. It's very infrequent that you're spending 10 minutes within 6 feet of another individual. In place that might make it so that if somebody is not medically able to tolerate a mask, they will still be protected, whether it's the employee or the customer. So I would urge us to remember that a lot of our response to COVID-19 has really been from a place of compassion and kindness and trying to protect other people and preserve life. And so we can come from a place of curiosity of, I wonder why that person's not wearing a mask, as opposed to, oh my gosh, I'm going to die because that person's wearing a mask. It's not that extreme of a risk in those types of situations. All right, so I think that is most of the questions. Is there anything else you'd like to add, Under Sheriff?
No,
or did
just
we cover it?
Forward tomorrow, and again, social distancing is the key right now. We're going into holiday weekend, so I know the gatherings, as we talked about, are there, but just really encouraging people to maintain and adhere to the social distancing guidelines.
Yeah, to really be safe this weekend. All right, thank you, everybody. We appreciate you joining us. Take care.